to Just Us Thinking. I'm your host, Michael.
And I'm your co-host, Rebecca.
And I'm the behind-the-scenes guy, Mikey.
All right, and we have a special guest in our office. We have Chris Johnston.
Thank you. My name is Dr. Chris Johnston, Quality Care Chiropractic. It's a pleasure to be here.
All right, you want to tell us a little bit about yourself?
A little bit about myself. Most of my life I've lived in Kansas and Oklahoma. Brother went to college up here, which introduced me to Nebraska, as well as a few friends, which you two are one of the crew that talked me into opening up my practice up here, thank God.
Woohoo!
Graduated with my undergraduate from Loyola University and then got my doctorate from Cleveland Chiropractic in Kansas City. I hold a doctorate in chiropractic medicine as well as a bachelor's in history and a bachelor's in biological sciences.
Nice.
So that's a lot of schooling.
That is a lot of schooling.
I also have a minor in chemistry and vocal.
Oh, wow.
Yep. And I don't think these mics are going to be a little too sensitive for him to sing opera, so
Yeah.
we'll try to avoid that. So
He looks like he's up for a challenge, though.
he always is up for a challenge. So how long have we known each other now?
Oh, heck. Since probably 2009, 2010.
Long time.
Yeah.
Wow.
Well over 10 years.
Yeah. So we played online video games together.
Mm-hmm.
That's how we met, through a mutual friend. And then we talked to you into coming up to Omaha.
Yep. First game night.
Yep. So you came up here, and then we slowly talked you into coming and opening your practice up here.
Correct. I believe your comment was, what do we have a lot of up here? Ice. I was like, okay. And what happens to people on ice? They slip and fall. They need you.
Yep.
And that was the main argument that got me up here, is that a lot of people in Nebraska, whether it's slipping on ice, whether it's piling snow, whether it's actually falling off ladders while putting up lights or clearing snow or doing gutter work, it's you see a chiropractor after.
Of course you would do that.
Right. We have good agriculture up here, so you got to think people that are working out on the farms and everything.
I have a lot of farmers and construction workers. Some of my most avid are actually nurses and pharmacists who come in.
Oh, wow. Okay.
Interesting.
That is interesting. So,
All right. So who or what influenced you the most to go into chiropractic care?
So originally, I was a pre-med chemistry student in undergraduate. I was on the fast track, which was a condensed program at Loyola University to get into Tulane's medical program.
Oh.
Kind of burnt myself out. From there, I continued my education from chemistry into biology with a little bit of music, singing with the New Orleans Opera Company, which was an absolute amazing thing to do. And then I was actually working as a bartender in Oklahoma at a private club, Cherokee Yacht Club. And through that, making a lot of connections with doctors, orthopedic surgeons, anesthesiologists, private medicine, all of that. And what ended up happening is Dr. Steve Hayes, who is my mentor, approached me and he's like, Chris, I know you want to do medicine. Have you ever heard about chiropractic? And I was like, no, I've never heard of chiropractic at all. I don't know anything about it.
Really?
No, really. By that time, going through med school, I had not known what a chiropractor does. I'd never been to one. So I actually just knew him and knew a lot of his patients who were at the yacht club and a lot of people around Tulsa who knew him. And just nothing, just complete praise about him. And he actually, the funny thing is, him and his closest friend, Terry Frost, approached my parents before they approached me and said, hey, is it okay if we talk to your son about being a chiropractor instead of being a medical doctor? We want to make sure it's okay with you. And my parents gave him the go-ahead. And then Terry and Steve sat me down. They're like, Chris, we understand you want to be a doctor, but here's what a chiropractor does. A chiropractor deals with patients one-on-one.
Yeah.
And on day one after a visit, you actually see a difference in that patient. It's not just covering up the effects of disease. It's not just hiding it. It's not just masking the pain. It's actually fixing the problem.
That's very interesting.
It's an amazing thing. And Steve said, you are a people person. You love people. You build relationships with them. That's what a chiropractor does, because a chiropractor makes such an effect on a person's life that in most cases patients become friends and then also soon become like family.
Oh, wow.
So it's and he was exactly right. That's what happens, is that a lot of my patients, and some of the comments are, when I'm adjusting patients and they've been coming for about a week or two, I've had one patient say, "Doc, this is probably the closest relationship to a guy that I'll ever have, and that I'll actually ever say that I have."
Right.
Oh,
So,
wow.
well, let me ask you another question. So if you had to go back in time and make a choice again, would you choose chiropractor or would you choose medical?
No, I would definitely choose chiropractor. It's awesome the way that the experiences that you have and the path that you're on build up to who you are. I am a chiropractor with a pre-med education. So I've got the same kind of biology that a lot of chiropractors do. We all learn the same physiology, neurology, biology, the same or even more than doctors during school. We actually have more class hours that we learn about it. But I have a more extensive background in chemistry because of my undergrad that I started out as pre-med chem.
All right.
So I understand a lot more about what's going on with pharmaceuticals, the body chemistry and everything else, and also what's going on with the lab work.
Yeah, we always kind of ask you if we have any questions. We're like, hey.
We do. We kind of utilize you quite a bit for that. So what makes you different than other chiropractors in the area?
So a lot of chiropractors in the area, they focus mainly on the spine, which is on the neck, the mid-back, low back. I take a whole body approach. I adjust wrists, I adjust shoulders, I adjust elbows, I adjust ankles, I adjust knees. And one of the things that gives the backup for that is what we call the domino theory. And as you know, with a pair of dominoes, you click one over, all of them fall until they hit the last one and there's none other to fall over. Well, your joints work the same way. It's just like a car. If one joint is out of place, it affects the movement of all the joints that are connected to it. And then those joints connect all those and affect all of those. And it's just a complete theory until all of your body is imposed. So what I do is I start and focus on the area of pain, and then I work outward, adjusting and making minor adjustments to the other bones around so that everything is moving together as one unit rather than just focusing on the spine and allowing the rest of the joints to, over a longer period of time, to adjust and readjust to what's going on in the back.
Okay.
That's a different way to look at it. I've never really thought of it that way. So, wow.
That's yeah. I mean, if you're having issues with your leg or your ankle or your knee, it keeps throwing your back out of line. Yeah, you're going to keep realigning the back. If you're only focusing on the back, you're not actually ever solving the problem.
That's true.
It's kind of interesting because you get a lot of patients who come in here with lower back and hip issues. And if you didn't know to look at the ankles and the knees and ask those questions saying, okay, so how do your knees feel? How do your ankles feel? Do you feel like you have motion anywhere? And they say, well, I mean, no, same motion as any other time. I was like, okay, so have you ever sidestepped on your foot or your ankle and rolled your ankle? And in most cases, everybody has at some point in their life, but they've never thought of that making an effect.
Right.
I
And
was
so
gonna say,
then
who hasn't rolled their ankle?
Right.
and so then you go in and you adjust the ankle, you adjust the knee, and find out that those are out of place, and that might be the reason why that hip and low back is out of position, is because the ankle joint has no motion or irregular motion.
Yeah.
And so the back will keep coming back and getting hurt and having pain until you fix that ankle and that knee to make sure that those joints are moving properly as well.
That's
Okay.
a very different approach. I guess we've never talked about it this much. So yeah, it's kind of interesting, really.
Yep.
So, all right. So if you have someone who's skeptical, how would you address their concerns? And have you had any bad experiences?
Well, every chiropractor has different experiences, and what you have to realize is that really only 8 to 10% of the population sees a chiropractor.
Oh, wow.
It's very, very low. And one of the reasons that is because they hear certain things, whether it's from medical doctors or other people who don't have chiropractors or people who have had bad experiences with chiropractors, because there are bad medical doctors, there are good medical doctors, there are bad chiropractors, and there are good chiropractors. And when I hear a lot of complaints about people, when I go and talk with the National Chiropractic Physicians Association at all the state tournaments in Nebraska and everything, and at all my conversations with them, it's like, well, I just had a bad experience. And my comment to them is, try again. Find a different type of chiropractor, because no chiropractor adjusts the same way. We all have the same techniques, but each of us is a little bit different in how we adjust and what we adjust. So it's kind of an interesting thing, because if one chiropractor doesn't work for you, that's perfectly fine. Try to find a different type of chiropractor. A lot of chiropractors adjust side posture. I don't adjust side posture. I do seated posture.
What's side posture?
So side posture is when you lay the patient on their side, and then what you do is you actually place your index finger and whatnot on your back. And then with a kick with your knee on their knee, you actually go down towards the floor and roll them.
Oh, yeah, I've had that
side
done.
posture.
That's, yeah.
Now, you have to be very careful when doing that kind of technique, because you can also cause more damage to the discs in the low back
Yeah.
than you can actually help.
I always
Because-
thought I was going to roll off the table or something on them.
Well, no. Well, you have to think about how an actual injury to the disc happens. In most cases, it's when a patient is bent over, whether in a garden or picking up a box or whatever, they're in a bent over position and they rotate their lower back, and that's when the injury occurs. Well, and one of my mentors pointed this out. Well, that's what happens when you put a patient in side posture.
Oh, yeah.
And so by doing it in seated, it's a lot less force required on the patient and a lot less pressure on the disc. So that is one thing where I've had patients come in and say, sorry, doc, you don't do side posture. I'm going to go find a chiropractor who does.
Oh.
Very rarely will I do side posture. It's only when the joint is absolutely fixed and not movable that I'll do side posture. But I haven't found a patient yet
Yeah.
that doesn't like seated over side posture. And I've been able to get people in seated position where they've said a chiropractor has never been able to get my back like that.
Oh, wow.
So it's all about positioning and everything else. There are some people who don't like seated, but it's just a matter of you've got to find out what techniques work for that patient and what best feels for them.
Yeah, see, I think I did both. And like he did the side posture thing, and I was just like, I'm gonna fall off the table and I'm gonna get hurt even more. I'm like, because I could see that happening with me.
A relationship with a chiropractor, you really do have to trust the chiropractor that you go see. Without trust, it's a lot more difficult, because the patients are a lot more tense in the muscles because of that fear.
Yeah.
And then also the patient doesn't relax. One of the key things I say to my patient over and over and over, and I'm sure you guys have said, is just relax, deep breath in, be Elsa, let it go.
So now that's interesting, because it is kind of an intimate setting. I mean, you're applying pressure, you're cracking them, kind of like what I said in our massage show. It's really intimate.
Yep.
So, and it's also very custom. A lot of people think, and I've heard medical doctors say, well, there's no standard for the pressure that you guys are using and everything like that. And my thought on that is, you may have to use more pressure than me than on somebody else.
Well, actually, there is a standard pressure. With the adjustments that most chiropractors do, we call HVLA, high velocity, low amplitude.
Okay.
So if you know anything about physics, the force equals the mass times acceleration.
Right.
So the faster the acceleration, the less mass is required for the same amount of force.
That's why it's like a quick jerk.
It's a quick, very short jerk, but it's speed. That's why chiropractors' arms, in most cases, if you look at chiropractic arms, their triceps will actually be larger or equal to their biceps, and they'll actually have very strong arms. That's because of the velocities that we actually employ when we're adjusting people. It's very much a workout for a chiropractor. It's why a lot of chiropractors will only be open 4 days a week, because if they see that many patients over 4 days, they've got to have time for their muscles to recuperate to go back the next week. That's why a lot of chiropractors have to set a threshold of how many patients they're going to see, because their muscles and the amount of work that they do, they can only do so much.
Yeah.
So you could become a bodybuilder if you're doing that. Just adjust everybody every day, all the time.
In actuality, my mentor, Steve, said, don't go to the gym. The moment you hit 50 patients a day, you don't need to go to the gym anymore.
Oh.
Because if you go to the gym after seeing 50 patients, your arms are going to be weak and in fatigue the next day that you see the patients. So for him, it's a lot more do your cardio, stay in shape, eat healthier, but don't overexert yourself and become that bodybuilder idea, because in most cases you're going to come back the next day after a good thorough workout that most bodybuilders say they have, and your muscles are going to be so fatigued you're not going to give 100% adjustment to that patient.
So what would you say is the top 3 ailments that that they come for?
So the top one is always going to be low back pain.
Really?
That is probably the highest. The second one that I see is probably migraines and headaches.
Okay.
And then the third is it ranges, and I'll say extremity adjustments, because the third equalizes with extremities of ankle problems, shoulder problems, wrist problems, and they all equal out to about the same time. I think one of the most amazing things that one of my patients came in for, and she'd seen a chiropractor for years, she actually lost her hearing in her right ear.
Oh.
And this had happened to her a couple of years ago, and she went to go see her chiropractor, and with a few adjustments, her hearing came back. Well, she went to an audiologist and an ear doctor to actually see if there was an infection or whatever, and the doctors couldn't see any infection, but just in case gave her an antiviral. We're like, here, this is probably doing this. If it doesn't change, if it doesn't get better, let us know. Well, after 3 days of taking medication, it actually gotten worse. So remembering she had seen a chiropractor when she was in high school, she came here.
Mm-hmm.
And we found out that her C2 was out of alignment. And C2 is what connects to the auditory nerves and has to do with hearing. C1 has to do with vision, which goes to the original story about how chiropractic began. C2 connects to the auditory, which affects sound. So the other thing we also found out is that her sinuses were irregular pressurized, where one side was more pressurized than the other, heavier pressure on the right side where the ear problem was. So what we did was we actually adjusted at the C2, then did some craniopathy to equalize out the pressure, and by the end of the adjustment, her hearing was all back to normal.
Oh, wow.
So, and it's interesting you say that, and because I mean, I have migraines, so that's something I will say. And a lot of my migraines are because of my eyes. The light bothers me. So you've adjusted me.
We adjust your C1 whenever you're having a migraine.
And that seems to work quite a bit.
Yeah. Usually your migraines will either decrease by 50%, or within half an hour after adjustment, you'll be back to normal, where I've seen you walk in with heavy duty old style engineer glasses that block out all light, and
Right.
with you and a couple of my other patients, we actually have to turn off the light in the adjusting room to be able to adjust you, and
Right.
then afterwards we're able to turn the lights back on and you're perfectly fine going out. It's just that you're always hungry afterwards.
Yeah, I don't know what are you doing to me there that makes me hungry?
So
I have to eat something every time I leave here.
and you're not the only one. So adjustments have different effects on everybody. So when you adjust people, they have certain endorphin releases, which is why when you leave a chiropractor, in most cases, you have that kind of high, lightheaded feeling, that feel-good feeling. It's because during the adjustment, we actually cause an endorphin release, especially if you use E-stim acupuncture like we do.
Oh, yeah.
And the body releases endorphins and healing factors and pain relievers into the body that are just natural.
That's right. You electrocute our ears.
Oh, I don't electrocute you. So
What is that little machine?
So it's what it's called a Pointer Plus E-stim device.
Okay.
It has an adjustable setting to increase the amount of electricity to the point that we connect it onto certain acupunctures in the ear, which most people don't realize is actually a main circuit board for the entire body. And depending on where it is in certain situations on acupuncture point, you have it on a certain setting. And instead of using a plain needle, which you would have to clean every single time or whatnot and worry about infection and all that stuff, you actually use an electronic E-stim device, the Pointer Plus system, to activate that acupuncture point, which in most cases will speed up recovery by about 2 times the normal rate, as well as increase also endorphins associated with that acupuncture point.
Yeah, I love your little e-stem machine. That's awesome.
Yeah, I will say you're the only person I've ever been to a chiropractor and actually used that device. Now, some will have you like lay down and they'll put like electrodes on your back. I've been to that. Seems a little bit more, but yeah, with you just plug that thing in your ear and different spots. It's kind of crazy.
There are, I know at least 20 other chiropractors in the Omaha area that do the same thing. We are all a part of Pinnacle Management Group. It's an absolutely wonderful management group. The people there are absolutely awesome. The mentors are awesome, and I've learned a lot of what I do in the office from them. And that's actually the management group that my mentor, Steve Hayes, started, which he's actually stepped away from and retired. But it's probably one of the only management groups that is actually controlled by the members now, which was one of his hopes, to create a management group that wasn't just controlled by one or two people or a board, but actually controlled by the members themselves.
Oh, it's kind of like a company-owned or an employee-owned company.
Yeah.
Oh, that's kind of cool.
Oh, yeah.
So what should someone expect when they come into a chiropractor? So let's say I've never been here, never seen you before in my life.
Right.
What do I expect?
So the first thing you're going to have to do is fill out paperwork.
It's always paperwork.
It's always paperwork.
We all love paperwork.
Everybody loves paperwork, but what a lot of patients don't understand is the paperwork you guys fill out just that one time on that first visit until the first couple, we have to fill out about that same amount of paperwork every single time that you come in.
Ooh.
And
Yeah.
so the people, and you guys have given me crap about having a 2-hour lunch period every day.
We do.
What you guys don't understand is that 2-hour lunch period is usually used to catch up on paperwork filings for insurance and medical filings. So
Well-
it's not really a full lunch break, it's paperwork.
We know that, but that's not going to stop us from giving you you crap for it. It's just when we saw your hours and then you're like, you have a 2-hour lunch break. Now I know, Michael knows that you're going to be doing paperwork, and chances are you probably run down the street to Arby's, grab something to eat, and it's like 15 minutes for your lunch and then an hour and a half, 45.
And trust me, every single manager, over the last 3 years, I think I've trained more managers than some of the managers. And even the owner would actually, and she still drives out from Des Moines, Iowa every so often to come see me, because she said, Doc, I don't know why there's not a line outside your door, because I drive 2.5 hours to come see you. So the one thing about patients is that once they find a chiropractor that relieves their pain and that works, they will drive the distance to come see you, no matter where you are.
Okay.
That's true.
So it's all going back to that building the relationships with your patients and that trust.
Yeah.
Okay. So now we got the paperwork filled out. We're good there. What's next?
So the next thing we're going to do is that we're going to go into the office and we're actually going to do what is called a consultation. During that consultation, I'm going to look at everything that you filled out on the paperwork, from how bad the pain is, from a level 1 to 10. Is it dull, achy, sharp, stabbing? And what a lot of patients don't understand is that when they're filling out this paperwork, every single box they check helps us determine, before we go into the exam, where the pain is coming from and what's causing the problem. Because that paperwork, when it's dull and achy, usually muscles are involved. If it's sharp and stabbing, it's very neurological. You're going to worry about more of a nerve impingement problem when it's sharp and stabbing. So every single keyword that you use can either say it's a combination of problems or a single problem, and help us determine what we need to do with that on that exam.
Okay.
So, and then it's just a conversation of, okay, what happened before this pain started? And you hear a lot of patients say, Doc, I don't remember doing anything. And it's like, okay.
Let's be honest. You said that a lot of people don't come to a chiropractor. So, the honest answer here is they've been dealing with this pain for like 15, 20 years,
In most cases,
they have no clue.
Yep.
Yeah.
A lot of cases, the pain has been going on for a long time, and they don't even have a memory of what's going on. So in that case, it's like, okay, what brought on the most recent pain that really set it off that you're coming in here? Because the mechanism of injury also then helps us determine, okay, it helps us determine what's going on and what caused it, and also the functional dynamic about what caused the injury, therefore figuring out what's actually causing the problem and how we can fix it.
Okay. So consultation, you got all the information that they're going to tell you, and they don't ever. No patient ever tells you everything.
Right.
Let's be honest.
Yep. True.
So then, what's next?
So then what's going to be happening is that we're always very upfront with our patients. We have already looked through their insurance, and we try to give them about a base amount of what it's going to cost. And the determination of cost is also going to be the determination of what they put on their paperwork. So it's a very simple, easy problem that they say it's just kind of a 1 to 2 to 3 on a pain. There's no radiation. There's no major injury. It's going to be a simple low-grade exam. Now, if they get up to the point where it's level 5-6.
And what's a 5-6?
So level 5-6 is basically to the point of I'm having trouble walking, I'm having trouble sleeping, I can't put up with the pain anymore. It's
severe.
basically affecting my function.
Okay.
And then you get up to level 8-9, it's when I see patients basically leaned over, barely walking into the office, and it's kind of like when you're in a migraine, you're assisted by your son and wife,
Yeah.
and in total lockout, and you can barely move. So that's
Right.
going to be that 9-10. So when you come in for your initial exam, the level of examination and cost is dependent on what your pain level is and what's going on.
Okay.
And then that's also going to determine whether or not we're going to take x-rays. On a low-grade problem, we're not going to take x-rays. X-rays won't be needed. You have a middle grade problem where there's a slight radiation up the back or down the back or whatnot, more than likely we're going to take x-rays. If you come in with a 9-10 problem, you're getting x-rays because we got to make sure nothing else is serious going on.
Right, because if something's broken or something major is wrong,
Correct.
and you adjust them, you can hurt them.
Exactly.
Oh,
And I never want to hurt a patient. And I've had a patient come in and he just wanted a simple adjustment. But his history said otherwise, and he was a little upset about me doing x-rays and the cost, and so he left. But unfortunately, when given those kind of backgrounds, it's not only for our protection to make sure that we don't hurt the patient and get sued or whatever or lose our license. It's because you don't want to do more damage to the patient and cause them more of a problem than anything.
Yeah, because
See-
what if they have like a broken rib or something, and
Well,
you mess that up even more?
And that's what I like about what you do. I don't want someone. I have always hated those people that will say, "Yeah, I could do the job," and they really can't do the job, or they can't do it effectively. If you can't do the job, don't make it look worse, or don't make the whole situation worse. So I like hearing that someone will say, "Hey, I'm going to walk away because I'm not comfortable doing this."
Yeah.
Because it's you're going to need a little bit more. So I kind of like that. I kind of like that. You're not just, I guess I want to say ambulance chasers like a lawyer there. Yeah. And some of unfortunately, those chiropractors get bad reps.
Just like medical doctors and lawyers and chiropractors, there are all those kind of sorts that do that.
Right. You're not one of them.
I'm not one of those.
Right.
One of the greatest things, and I think where I get most of my patients are from patients' referrals. About 70% of my patients are from referrals from other patients. Usually I end up starting either with a kid who has a problem, and then the mom and dad start coming in, or the mom or dad come in, all of a sudden I'm seeing their husband, their wife, their kids, their newborn family, their daughters who have other families and their husbands. And so it's very much that, and I hear the comment of, "Doc, we used to see a chiropractor, he retired 5-6 years ago, and we haven't found anybody that
To
we
replace
trust
him."
or that
Yeah.
works."
Right.
And then they found me, and all of a sudden I'm taking care of not only the husband and the wife, but their mother and their father, and then their sisters, their brothers, and then all their kids. And the largest family I see is actually a family of about 10.
You get around, don't you?
Absolutely. And I've got patients that drive on from Kearney, from Lincoln, all the way from Council Bluffs. Like I said, my patient from Des Moines. And one of the easiest ways is because I'm right by I-80 and 370, it's a lot easier for people to get to me via that highway, especially on the northern end and whatnot. And it's an amazing feeling to know that people will drive that far to see you. I had a patient that came in, she got off work late yesterday at 6 o'clock, and we usually close at 6, and she said, "Doc, I know you're closed. Are you by any chance going to stay late tonight?" Because every once in a while I see so many construction workers and everything that I stay late to them for till about 7 o'clock, because a lot of construction workers don't get off till after 6.
Right.
Yeah.
And so outside my normal hours, I do special appointments for those who call, and all my patients know that no matter what, even if the doc's not out of office, he's got his cell phone his office phone forwarded to his cell phone so that we can get hold of an emergency. But she called, and she came in at about 6:20, and she actually brought her sister, and they both live in Council Bluffs. And the sister goes, "Yeah, I don't know why my sister drives all the way this half an hour to come see you." I was like, "Well, let's you know what, let's take care of you today. You've got some problems, I heard, so let's see what we can do for you." And by the end of the visit, she looked over at her sister, and I said, "Now I know why you drive half an hour to go see him." So it's an amazing thing, and it's just getting past that point. And I know I follow the same kind of fees that I do with the insurance companies. I don't change my fees at all. Everything is just dependent on what we do, how much we do, and everything else. So getting back to, we've kind of got off topic, but getting back to post-consultation, after that consultation, what we end up doing is that we end up going to the exam room. Everything starts off like a basic medical exam where you take height, weight, and then also blood pressure. And I always tell my patients when they're taking their height, I said, don't be surprised if the next time we do an updated examination, if you've gained half an inch to an inch. Because what a lot of people don't understand is when you go see a chiropractor, in most cases, we're going to fix your poor posture, we're going to fix a scoliosis, something, and you're actually going to grow in height.
I'm not 6 foot yet.
No, you're not 6 foot yet.
I was hoping.
You have a ways to go, baby.
And then from there on, depending on what one's consultation, we're probably going to do a couple of orthopedic exams in the area of complaint. We're going to do probably a couple of reflex checks as well as muscle strength checks. And then also what we're going to do is what we call a full scan. And that is where we actually, hands on hand, feel each joint to see where there is either a lack of motion or where there is pain when we press. And one of the things a lot of my patients say, "Doc, even if I don't have pain, you just are able to find it." And that's because it hasn't gotten to a point where the body is relaying an emergency message of pain to the patient. So it's actually getting ahead of the problem and fixing it before it becomes a problem. So after that comes the fun part, the adjustment.
Oh, okay.
Oh, yeah.
And then with the adjustment, it's different from every patient to patient, and every patient has a different reaction to it. I've had patients who groan. I've had patients who actually yip you like a dog. I've had patients who kick themselves. I've had patients who flail, just because of when you adjust a patient, you see and actually make an impact on the nervous system with each adjustment. And so there's always going to be a little bit of reaction. You and several other patients call it oh so feel good pain.
Yeah.
Because sometimes it's very painful for a few seconds, but then later, especially after the inflammation has come down, it's no more pain or less pain, or the problem's been fixed, or we slowly move down.
I'm that way with my neck. You know, it hurts when it gets adjusted, but I know 20 minutes later I'm going to be okay.
Yeah.
So
and
I can deal with a little pain.
I call that the Band-Aid. So, you know you're going to have to take off that Band-Aid. You know it's going to hurt.
Yep.
It's going to pull some hairs, but the quicker you yank it, the better off you're at.
Yep.
So.
But and that's also kind of where a lot of fear comes with patients, is because they've heard about the pain. And the problem is, what a lot of people don't understand is the longer you take to go to a chiropractor when you have problems, the longer it's going to take to fix you. Because what the body ends up doing is that if it can't fix the spot where the problem is, it starts making adjustments and up and below that point in order to maintain its balance and posture. Because one of the main things that the body wants to do is subconsciously that fight-flight syndrome. It
Right.
wants to be able to run away in a dangerous position. So in order to be able to do that, it's got to maintain its balance. even though it may cause pain, it may actually affect nerves where you're having other disorders like digestion or heart problems or breathing problems. It's going to adjust because its main thing is to have balance. And when a chiropractor goes in there at first and tries to adjust, the body says, this isn't what I need to have my posture in balance. This is not my setting. I've got to revert back to what I know so I can get away if I'm in trouble.
Oh, right.
And so what ends up happening is one of the reasons we have you come in so much in the beginning is so until that body impacts and says, okay, maybe I need to start resetting my systems, because not only am I functioning better, but I'm also maintaining that balance and have the ability to run away. So it takes a determined amount of time in order to do that. So it's difficult to tell people that we may get you out of pain, but you may not be completely fixed yet.
Right, it's like muscle memory. So it's going to resort back to that old one,
Correct.
and you'll have to make the readjustments. So now, outside of chiropractic, chiropractors can do other stuff, can't you?
Yes. And actually in Nebraska, and you always have to check state by state because every state law is a little bit different.
Right.
Chiropractors are actually able to do sports physicals.
Which you did for Mikey here.
Correct. And the funny thing is that in most cases we can do sports physicals, but we can't do school physicals. And one of the things is because with a school physical, a vaccination report is required, and chiropractors don't do vaccinations.
Oh, yeah.
So you have to go to a medical doctor for a school physical, but not for a sports physical. So chiropractors are actually able to do sports physicals. It's the same thing with the trucker licensure and physician assistant and assessment, is that we can actually do, I believe it's a DIC licensure physical, to where they actually have a physical before they have to go get their trucking license. I don't do those here because I'm not registered for it and certified for it, but I am certified for the sports physicals.
Oh, okay.
That's very cool.
Yeah.
And like I said, since we got Mikey's down here, I didn't know you guys could do that kind of stuff. So that's really...
Well, yeah, because Mikey was going to start doing some sports this year, and then we were just happened to be here, and I didn't know you could do that at first, and I flat out asked. I said, "You can't do a sports physical, can you?" And I kind of was joking a little bit, and you're like, "Yeah, no, I could do that." I'm like, "Well, that saves us a lot of time and trouble."
Oh yeah, no, and the thing is, when a lot of people go and get their sports physicals, they go and they try to make an appointment, and they have to wait a month or two in order to get in with their PCP or primary care physician or a medical doctor to get it done. Or in the schools, there's long lines or whatnot when they're holding. When they get into those sports seasons. But in most cases, chiropractor is licensed to do a sports physical. It's just a matter of, does that chiropractor have time in the schedule to do it? With me, I try to, especially around sports seasons, have a certain time or use my lunch period in order to do them.
The 2-hour period?
Correct. The 2-hour
Okay.
period,
Just wanna make sure.
which I get a heck for, like I said, if I'm in here doing paperwork and somebody needs a sports physical real quick, all they got to do is call, make a special appointment, we get them taken care of, whether it's before hours. I've got some patients who go to work very early, but they are on a maintenance wellness program that come in once a month, and they're like, "Doc, I got to be at work at 9 o'clock." And it's like, okay, not a problem. I can come in. I'm here cleaning at 8:30 in the morning. Problem. We'll go ahead and get you in. We'll get you adjusted at 8:30. I just apologize. It's not going to be freshly clean and smelling like lemons when you usually walk in. So it's just a matter of being very adaptable to patients' time schedule. And I think that's one of the things my patients love about me, is that they always know if I'm in town on a weekend or if I'm able, I will change my schedule and go off hours to be able to take care of them. Because one of the things I want to do is I don't want my patients in pain. I don't want anybody to be in pain.
Right. So if someone had a car accident on, say, a weekend and had to come in here on a Saturday or a Sunday, they could call you.
Right. In most cases, with a car accident, most people will go to their chiropractor almost after it happens. The problem is post-accident, the inflammation will not start or peak until 36 to 48 hours after the accident.
Right.
So that's at the point that in most cases you'll start seeing your chiropractor probably 1 week after the accident, because all that inflammation, all the muscle irritation, you probably won't even feel and won't occur until that second or third day. And that's what a lot of people don't understand with accidents, is they may feel absolutely fine directly after, not only because of the endorphins released and also the adrenaline released from that accident, which reduces pain, because that's one of the neurochemicals in the body that reduces pain. Part of that fight flight syndrome is that injection of adrenaline, not only to increase heart rate and oxygen absorption, but also releases complete pain relief throughout the body, so that you can't feel that you're injured, because the body wants to run away. It doesn't care if you're injured or not. That subconscious thought of running away, it just, let's go. It doesn't matter if we cause more injury, we're going.
See, now while you're explaining that, I'm getting the evil eye from Rebecca here.
Yeah.
Because after my car accident, which was on a Friday, I think you even said at the hospital, I don't know how you're still standing or moving around.
Yeah, because that was a pretty...
It was a pretty serious accident.
Yeah.
And
Well, I remember that phone call, and just so listeners know, the only reason I'm able to talk about this is Mike has signed a HIPAA release.
Right.
So whenever a doctor talks about a patient specifically, we always have to make sure we've got the HIPAA release. Whether it's your husband, your wife, or whatever, we have to have that HIPAA release to be able to talk that. And Mike has signed that and done that. So, but the funniest thing was, and God, my prayers went out to you, and I knew you were going to be in pain, is Rebecca texted me and said, hey, Mike's been in an accident, and he's not feeling any pain. The doctors aren't giving him anything.
Yeah.
We're heading out. Is there anything I need to know? And I told her exactly what I told everybody about the inflammation after a car accident. I said, it's going to peak within 36 to 48 hours post-accident, and that's when he's going to be in pain. I don't want to see him until after that 72 hours.
Right.
Because that was going to be affecting your migraine headaches, your muscle spasms, everything else.
Right.
And I remember you calling and texting me and saying, I don't feel any pain. I said, wait until 36, 48 hours after the accident. And you're like, it's not going to happen. And 40 hours later, you text me and like, I can't move without pain. I was like, that's because you're at the 72-hour mark.
Yeah. So we came in here on a Sunday.
We did, yeah.
We did, of course, it was a car accident, so you had to do the x-rays. Mm-hmm. We knew that was going in, did the adjustment, and then took a lot to get that, me back on track. Yeah. So that was pretty crazy. So now, what is a good phone number for you if anybody wants to call you?
So anybody can call the office. The number at the office is 531-375-5077. Whenever I'm not in the office, I've actually always got it forwarded to my cell phone. If I don't answer my cell phone, more than likely I'm either with a patient or doing something and can't get to it, but I will check the message and get back to them as soon as possible.
Now, that doesn't mean call them at 2 o'clock in the morning. Don't do that. Call normal business hours.
Right.
Well, I always tell my patients, but even in effect, I've had patients who call me at 5 a.m., a couple of my construction workers, and say, Doc, we just had an accident. Can I come in? And I'm there. I've been there at 6 a.m. for those construction workers, or 7 o'clock, because if they've had an accident that late, I mean, if I'm able and I'm awake, I just say, okay, give me about half an hour. I'll meet you at the appointment. And I've had a construction worker come in where 3 of the guys are carrying him into the office because he's thrown out his back
Oh my
on
God.
a construction job. And
See, I always have this.
So,
You live right down the street from here, so
yeah,
I mean,
I live 5 to 10 minutes away from my office.
and I could just imagine calling you at like 2 o'clock, 3 o'clock in the morning, and say, "Hey, I need help," and then like you showing up in your pajamas.
No. I may show up in jeans or shorts and a t-shirt, not my scrubs attire, but I'll be here for that.
Yeah.
But I always
fuzzy slippers.
I always ask my patients, please do not call after 10 o'clock unless it's an emergency. And if I'm able to see you, I'll see you. But there are also sometimes when I've told patients where I've had a long day on a Friday and I get a late call on Saturday and they're like, hey doc, can you, I've got to go to work. Can you see me at 7? It's like my muscles are so tired. My mind is not there. It's like, I can see you at about 9 or 10 o'clock. I'm sorry. My muscles, I've got to get the rest before I can actually take care of you. And so then I'll see them about 9 or 10 o'clock unless it's an absolute emergency.
Well, you got to understand that you have work-life balance as well. Yep. I mean, you can't just be at the beck and call all the time.
No.
You bend over backwards from everything I've seen for pretty much everybody.
Oh, yeah.
Oh, yeah,
So,
definitely.
People need to cut you a little break sometimes.
Oh, yeah. Well, and then the hard...
Not me.
Well, sometimes after 11 o'clock, it's Mike. I'll call him in the morning. But it's It's really hard for a chiropractor because the more patients we have, the harder it is for us to be able to make those changes and those
Flexibility.
Yeah. Because we're so tired, and we've got to have that rest time, and we've got to have that family time just like anybody else, because otherwise we get drained. It's just like nurses and doctors who work 2-3 different shifts. By the time they get home, they're just drained, and they have such a short that they retire by the time they're 40, 50. I plan on doing this like my mentor until I'm in my 70s and 80s. There are a lot of chiropractors who go until they pass away.
Oh, wow.
And they see a certain amount of patients. In my case, we see about 40 to 50 patients a week right now. So I have that energy and ability to be flexible and go outside my hours. Now, I know a couple of my mentors and another couple of chiropractors who see 400 to 500 patients a week.
Oh, wow.
Wow.
And one of the reasons they can't be flexible is because they work those long hours. They try to fit all of their patients into those 3 or 4 days that they're open, and then they've got to have that time after in order to recuperate, to be able to keep taking care of their patients in that shorter amount of time.
Yeah, you should send them, have them send your patients to you when they have an
Right.
emergency.
Well, like I said, there are actually some times when those doctors get sick that we actually send patients to those other chiropractors for a short time, whether we're on vacation or I've seen a couple of patients who their chiropractor's on maternity leave. They're just coming in for a couple of times and then going back. And so there are a lot of chiropractors work together, and a lot of people think that we fight each other for patients and everything. And no, that's actually not the way it works. A lot of the time is that we all have our specialties and we all have our patients. And like I said, that relationship once you build with that patient and that chiropractor, that they're a patient for life.
Yeah.
So now we're in Gretna, right? Is this area Gretna?
This is Gretna, yes.
Okay, so how do people get to you?
Okay, so we are over at 11314 Wickersham Boulevard, Suite 500. We're right off the corner of I-80 and Highway 370. And as I tell everybody, we're right by the Arby's and Walmart. And anybody around the area who says right off of I-80 by the Walmart and Arby's, I know where that is.
Right.
So,
Yeah,
All right.
it's pretty easy to get to. So, like you said, it's really convenient. So,
I would definitely recommend at least giving you a try. I mean, that's the problem is once they get in here, man, they don't want to leave, do they?
well, a lot of medical doctors actually call us crack dealers because crack dealers. I know, no dad jokes. Because once a patient sees a chiropractor, they really become a patient for life, and they usually come in once a month. And it's not because they've become addicted to it, even though they kind of have. It's because patients realize what chiropractic does for them and how good they feel and how much more they're able to do in life by seeing a chiropractor once a month, that they just know it's better for them, both financially and be able to live that social life, to be able to go. I've had one of my pharmacists who, before she started, funniest thing is she told me is that, Doc, when you said it affects my immune system, I thought you were full of
Right.
And then a year after, I looked at her, I said, so how often have you gotten sick over the last year? She's like, crap. And she looked over her fiance at the time. She's like, have we even been sick since we both started seeing him? He's like, no. And what you have to understand is she was getting sick 2 to 3 times a month in the pharmacy. And
I
so
could
she
see
went
that.
from getting sick 2 to 3 times a month, having to spend the money on medication, having to take time off of work. And she looked at me and said, Doc, I actually did the books. I can come in, see you once a month, feel absolutely awesome, not get sick, and I save money paying you cash than getting sick all the time at work.
yeah.
So
that's true.
it's where you put your priorities.
Yeah.
Well, thank you. It's I think we learned a lot now, didn't we?
I think we did too. It was a lot of good information, even that I didn't know. So,
And it took Mikey a few minutes to recognize that crack joke.
Not really.
You were a little delayed there.
it'll be okay.
He doesn't understand dad jokes.
It's
Yeah.
okay. It's a good thing. He's not a dad, so it's a good thing.
That is true. That
He's
is
still
true.
too young.
So no, thank you for joining us
Well,
today.
thank you guys for having me. It's been absolutely awesome.
All right. So Rebecca, what's our next episode?
We're gonna do some makeup questions with